Hello and welcome everyone to this edition of TMC Dialogues. We have with us today Professor R. Ramakumar, who is an economist at Tata Institute of Social Sciences in Mumbai. Uh, his primary area of focus is agriculture, but he also covers a lot of developmental economics and written extensively on the impact of COVID-19 on the economy. In the last few weeks and months, he has been writing extensively about the government's response and the policy on vaccination and what needs to be done, where are the gaps, what needs to be fixed, how, what needs to be done. He's also of the opinion that we should bring back the states in the game, and it should not be, and the vaccine should not be going to the mass markets in general. We will talk about that. We will also talk about the larger states versus free markets debate that has picked up pace recently in the US specifically. So without any further delay, welcome Ram. Stage is yours.
Thank you. How do we go about? I'll speak for some time and then.
No, I think Suri, would you like to ask the first question? Would you like to start?
Yeah, sure. I'll sort of go with it, Ram.
Sure.
I can call you Ram, right?
Oh.
Is that the way you're called always? Yeah.
Yeah, sometimes, yeah.
All right. Okay, Ram Kumar. So, look, I mean, there are essentially two parts to the entire vaccination debate that is going on, or rather the chatter that's going on. One is whether, predominantly whether the Indian government should have footed the bill and taken the entire vaccination program under itself. Whether that was the right thing to do. Because the moment they announced that the states will have to sort of buy the vaccines and sell, there was a lot of confusion amongst folks whether they will actually get the vaccine, how will this be executed, right? That's one part. The other part was that how was this entire vaccine plan sort of rolled out? It appears that some of the Western countries, especially the economies like the US, UK, Germany, they all seem to have had a very, very smooth vaccine policy where everybody got the vaccine by just going into a health center and getting themselves a jab, right? And therefore, that's the second part of how. So essentially, I would like you to sort of critique the first part of the debate, which is how much do you think the government should have, taken this vaccination upon itself? Should it have been an entirely a government affair? And what's the pros and cons, and what's the sort of global view on this?
Okay, thank you for this invitation. I think the first point to note here is that world over, vaccines are not considered like toothpaste or soaps or toothbrushes and so on. They're not considered commodities of that kind. They're considered differently. What differently means, they're considered as global public goods. Now, there are different ways of looking at what a public good is. In a purely economic sense, we could argue that public good is something which is non-rival and non-excludable, which has positive externalities and so on. But there are two ways in which vaccines are generally seen as global public goods. The first is that it is to be available to everyone, everywhere, at any point of time, at an affordable price, easy, effective, and easy to administer. Okay, so this is a definition that is offered by Doctors Without Borders, Medicines Sans Frontières. They put the definition of a global public good in this way. So seen in this way, you will see that if you want a vaccine to be distributed to everyone in this, meeting all these criteria that were listed out in this definition, the only way to do it is for the government to take up the job of procuring vaccines as a single procurer in a sort of a centralized form, and then give it to people. It may be via states, provinces, wherever, depending on the country that you're referring to, and given to the people free of cost. So free and universal provision of vaccines is an essential precondition for all these conditions being met for vaccine to be a global public good. There is another reason why it is called a public good, because it is a commodity which has got positive externalities. By positive externality, what we mean is, here, when I take a vaccine for myself, it is not just giving me the private benefit of being immune from infections and so on. It is also providing the society with societal benefits, because somebody will not get infected via me. That is another important benefit that comes from vaccination. So there is private benefit plus there is social benefit. But when I demand it in a free market kind of a situation, I will demand it, or my level of demand will be based on my private benefit alone. Okay, because there are information asymmetries. I do not know how much is a social benefit and so on. So I will demand the vaccine only to the extent that my demand is fixed as per my private benefit. But if I refix my demand based on my private benefit plus social benefit, I will actually demand it at a much higher level. Okay, so given that I demand only based on my private benefit, that my demand remains lower than otherwise. And looking at this demand, companies will supply vaccines. Their supply also will be lower because my demand is low. As a result, the commodity will be suboptimally provided to the consumers in the market. It will not be maximum production that will be offered. It will be a suboptimal production that will be offered. Right. So there are multiple reasons in mainstream economics itself where vaccines are recognized as global public goods and are given free in a universal format to everybody. The second important point here to note is that in countries like India, vaccination or right to free vaccines can also be seen as a constitutional obligation of the state and a right of a citizen. This is because right to life is considered fundamental under Article 21. And as the Supreme Court ruling very clearly suggests, right to free vaccine can be seen as a subset flowing from the right to life and also right to health in the Constitution. So it's also an obligation of the state to provide vaccines free of cost. The third important reason why this is the case is in most vaccine developments, the public sector and the government have played a very predominant role. If you look at United States, the United States government under Trump provided a grant of about $2.5 billion US to Moderna Therapeutics in order to help them develop the vaccine. If you look at Germany, they gave a grant of about 350 million euros to BioNTech, which is an associate of Pfizer. And also European Union gave another 100 million debt financing for them to develop these vaccines. If you look at the Oxford AstraZeneca vaccine, research has shown that 97% of the funding that went into the development of the Oxford vaccine was actually public funding. Okay, same is true for vaccines like Covaxin in India, where the IP is shared by the government of India and a private company like Bharat Biotech. So across the world, if you see, enormous amount of public investment has already flown into the development of vaccines and vaccine R&D, capacity expansion of vaccine companies, etc. And this money comes from taxpayers' money. Right. So you don't usually sell something to a consumer in the shop. After he pays the money, he turns away and walks away with the commodity. You call him back and say you have to pay again, right? Because he's already paid. He's already paid through the taxes. So it's akin to asking the consumer to pay twice when public funding has enormously funded research into vaccines. This is yet another reason why vaccines are supposed to be free, universal, and are seen as global public goods and not as an ordinary commodity. Right? The final point I would like to mention here is with respect to the point that I mentioned in my definition of global public good, easy to administer. Right? Now, easy to administer means the vaccine market should have some amount of systematic nature to it. Okay, it cannot be allowed to be fragmented. If the vaccine market is unified, it will be more efficient than when it is fragmented. Now, what the government of India's policy here has done is to fragment the vaccine market of India into many, many small pieces. Right? Central government has a price, state government has a price for Covaxin and Covishield separately, private hospitals has a price for Covishield and Covaxin separately. So there is competition between center and states, there is competition between states and states, there is competition between states and private hospitals, and there is competition between private hospitals and private hospitals. Right? So there is enormous amount of unnecessary competition being unleashed in this market, due to which there is major loss of resources of the players involved, all of which can be avoided. Efficiency can be raised and transparency can be maximized if there is a single procurer in the form of the central government who procures it,
Sure.
gives it to the states, which in turn gives it to citizens for free. This is the universally recognized path. That's why United States giving vaccines free, UK is giving vaccines free, Germany is giving free, France is giving free, except India. There is something really problematic in this approach of policy in India.
Right. So, there are at many times vaccines which are choice of patients. Suppose if it was a normal condition, if you go to a doctor, there are certain vaccines that are administered by choice. So that like a cervical, vaccine or something that which you can choose whether you want to take it or not. Right. Those are also vaccines that you think will be for public good if a lot of people take it, and therefore the society doesn't sort of progress in those diseases. The state will also save money in healthcare in those cases, right? So are we saying that this global public good is only in those cases when it is a pandemic sort of a problem, or is it a widespread problem and therefore you need to press that? Whereas in those other vaccines, I mean, it's a normal course, right? A kid is born, within 7 years, you get several other vaccines apart from, the normal ones that we know of, right? That is by choice. So is it because of a pandemic, you say that this should be a public policy sort of to administer free?
No, that it is not just because it is a pandemic situation. Even when it was an epidemic, as in the case of Ebola, the argument was the same. Even in the case of measles or polio, the argument is the same. See, vaccine markets are typically prone to multiple suboptimalities. This is primarily because for example, I'll give you an example, which you usually textbooks provide you with. If you leave it to private companies to do everything related to vaccines, the private companies will have a major incentive to delay the release of a vaccine. Why is it? An early release of the vaccine would mean the problem of the disease is solved early enough, and the private company which is releasing that vaccine early enough into the market is basically killing its own market. Right? Its future profit possibilities are being killed by itself. So there will be an incentive for the company to release the vaccine late rather than early. Right? So this is one example I'm giving you. So there are multiple examples like this, or reasonings like this you will see in economics textbooks, which will tell you that vaccine by nature, whether it is a polio-like disease or whether it is an epidemic or if it is a pandemic, the character of the vaccine as a public good does not change significantly. Right? Of course, when it is a pandemic, it becomes even more important as a public good. In fact, some people have been arguing that along with being free and universal, you should also make it compulsory. Right? Now, that's a different story. That's a different argument altogether, and we need not mix that with this particular argument or debate. But there is a good case for compulsory vaccination also, because if some people, say 20% of people, remain unvaccinated, they actually keep the door open for the disease to keep spreading in the society. Infections to spread in the society, the virus to mutate itself to new forms, and ultimately affect the remaining 80% who have had vaccination already also. Right? So there is a strong ethical argument to be made, or a philosophical argument to be made for compulsory vaccination here. But at the same time, at this point, what we are concerned with is keeping it free and universal. When we reach 80% coverage, 90% coverage, then we will have to think about how to vaccinate the last mile 20% or 10%. That we haven't reached there yet, so we need not worry about it as of now.
Right. So are we also used to paying for vaccination in India otherwise? You may say that, like for example, measles or polio is door to door and it is often free. But if you look at an urban family which vaccinates its kid, they usually end up paying a lot of money for the kid from 1 to 7 years or 1 to 9 years, right? And it is not a very well-known fact that vaccines are actually free in India. You actually pay for them, right? So is there a sort of confusion there that vaccine should actually be free, but most of Indians actually end up paying for vaccines, and there's another set who don't pay because it's, the government has a policy for them?
That's a perverse outcome of a particular system that we have, right?
Right.
The system of healthcare that we have in India is not as deep or widespread as you would see in Europe or United Kingdom and so on. So you will have public health centers, but they are very poorly developed and spread out. That's the reason why we have door-to-door vaccinations, right? People don't, there aren't enough public health centers to go to or vaccination centers to go to. Given this unequal or poor spread of vaccination centers and public health centers and so on, what we have is that gap being filled by private hospitals, which are primarily profit-oriented. So the polio vaccine is also available in the public health center as it is available in a private hospital. If you go to a private hospital, you will pay more for it and pay a price for it, and certainly pay a higher price for it. Now, a lot of urban middle class people end up going to these private hospitals because they have a certain feeling about public health centers being unhygienic, not providing good service and so on. So they end up going to private hospitals thinking that they will get good service there, and they sometimes end up paying much higher prices than you would pay otherwise. So it's actually a perverse, it need not be the case. In fact, world over, this is absolutely not the case. Maybe 2%, 3% people would do this by going to a private hospital and so on. In India, however, that share would be much higher, and that's not quite a good thing. And wherever you see where India has been able to achieve some kind of universality in vaccine distribution or vaccination, as in the case of polio, for example, the predominant role has continued to be played by public sector, right? Or public health centers, ASHA workers, other frontline health workers, and so on. They are the people who have been in the forefront, and private hospitals have played a marginal role even in a country like India.
And is it also because that the sort of sensitivity or the information about vaccination is also very poor in India? If you look at any other country, they could just walk in anywhere and get a short flu vaccination done, right? Which is subsequently a vaccine. So is there a issue with the government not being fully entrenched into this entire vaccination process? Also a cause for its dichotomy when it has actually sort of had to give per force to a large population. I mean, a polio vaccine and a measles vaccine are two examples in 30 years when we perhaps have had 4 or 5 or 6 governments, right? And therefore there isn't a continuity of a government. So you think that there is basically a policy problem in the government which is not very well established here?
I think that if you compare India's earlier vaccination experiences and the COVID vaccine experience, you will see that we have chosen to go a very different go a different way in terms of policy. With all the problems of India's public health system, poor investment, lack of staff, absence of enough infrastructure, and so on, we have somehow managed to develop a process by which we ended up vaccinating significant numbers of people in the past, children in the past. Now, there is a lot to be learned. In fact, India has enormous amount of learnings from those vaccination experiences, which it should have used in the COVID vaccination policy as well. However, we chose to do it in a different way. We chose to do it using an app called CoWIN, which complicates rather than simplifies the whole process, excludes large numbers of people rather than include, excludes people who do not know English, who do not have internet connection, who do not have smartphone, etc. So we have unnecessarily included organizational layers into the vaccination policy or process, which has actually not just complicated it, but also put it out of reach for millions of India's lower middle class and poor. That is
Right.
the problem here.
Sure.
If India had, that's what a lot of earlier health secretaries and all who are retired now keep pointing out in their columns and articles and so on, where they point out that if India had followed that earlier experience of polio vaccine, for example, where the central government was a single procurer, it gave free to states, and state gave it free to people, and the process was simple. There was even door-to-door vaccination which was available. In other words, the state governments had enormous amount of flexibility in deciding upon the nature of the vaccination process and so on. All of that has disappeared now. It is like a top-down centralized system through an app that you have now, which is actually making it making the whole process much less efficient and transparent
Sure.
compared to the earlier experiences.
I think we'll come back to that, the failure of the government to have a process and the distribution part of it. But let's sort of stay with, in that point where the government thinks it isn't its job to actually vaccinate the country by its action in the, you mentioned the right to life, right? When Justice Chandrachud spoke about it, the government came back very heavily and said that the executive is actually right in doing what it is doing. Naturally, when you say right to life, it doesn't mean that if somebody is dying, the government is actually going to take him to hospital and give him life, right? Or rather protect him. And therefore, there's a huge bit of debate about how much the government should do to right to life. And it is sort of, in this case, used it very, very nicely to say that we are doing what we can. So how much enforceable is this right to life? Because you said that the definition is to make, and vaccines are very different. They are different by definition, and they have to be made available to a lot of people. But the government is sort of shying away from right to life in a vaccine. So what gives them the ability to do so?
Look, this is not the first time that the ruling class in India, as well as India's civil service bureaucracy, has taken unilateral decisions with no regard to constitutional principles. I'll take you back to an earlier example of the Aadhaar project in India, where the bureaucracy tried to steamroll, with the help of a few technocrats, decided to steamroll that project with absolutely zero regard for constitutional proprieties or rights of citizens and so on, such as the right to privacy. Citizens had to approach the Supreme Court, and the Supreme Court, after a long time, through a constitutional bench, gave this ruling that right to privacy flows from right to life, which is the right to life that you're now talking about, right? Under Article 21. And now right to privacy is a constitutionally provided fundamental right of every citizen, right? And I see a similar situation emerging in the vaccine story as well. The bureaucracy, the technocracy, and the government has been insistent that right to free vaccine does not flow from right to life. That is a very dangerous position to take for a democratic government in a country like India. In fact, there are many Supreme Court rulings in the past which have recognized that right to free vaccine should be considered as part of right to life. And Justice Chandrachud's remarks follow from or build on those earlier Supreme Court decisions also. So in that sense, the statement of the government saying that the Supreme Court has no right to intervene in what is essentially an executive matter doesn't surprise me, because we have seen it earlier. Right? But what gives me hope in this whole story is just like the Supreme Court intervened in the Aadhaar story, where Justice Chandrachud's dissent judgment was much more radical than the majority judgment. I hope that situation will prevail again, where the Supreme Court will show the government its place and actually tell the government that it is indeed a part of its constitutional obligation to provide vaccines free of cost to everyone.
Right.
So I'd like to come in, Suri. Sorry for...
Sure.
Before I ask this question, guys, please go ahead and type in your questions in the Q&A box. We will take questions as we go in this conversation. I wanted to ask this question, and I see somebody else has also asked. Saurabh has asked the same question. I wanted to go back to your point of the government not using the examples of past learnings and deciding to do it differently, completely different this times, which is through an app, making it not so inclusive as it should be, and all those things. My question was, is it does the lack of enough vaccines has to do anything with that? That's number one. Saurabh is asking, what was there an issue with consulting earlier health secretaries, etc.? Was there a issue with consultation on this process, which is why this was done? And would a joint task force centrally driving policy procurement akin to the US have done better?
Okay, so let me say the lack of adequate number of vaccines is actually the elephant in the room. Okay, we are actually missing it in the finer discussions that we sometimes end up having. In fact, it's the point to note, or rather the point to start with, is that there is enormous amount of bungling on the part of the central government in planning for vaccines in India over the last year or so. Right? There are three important failures that I would like to underline here. First is the government of India very clearly knew that the demand and supply for vaccines in India simply do not match. We have, if we want to vaccinate everybody over the age of 18 in about 12 months' time or 1 year time, we need about 54 lakh vaccine doses every day. In fact, if you add up Serum Institute and Bharat Biotech, the total capacity does not exceed 26 to 27 lakh doses per day. So very clearly, this mismatch existed right from last year when the government started planning for vaccines. It knew it. That means it should have done three things. First, it should have given proactively more permissions for vaccines for use in India. Right here, the government stuck to what I think is a rather bizarre, based on no reason or rationale, a policy where it thought and argued that made in India vaccines will be adequate for India. So it stuck to Covishield and Covaxin. It gave them permission in emergency use approval in January. But when Sputnik V came for permission in February, you denied permission to Sputnik V, saying that it did not have immunogenicity data supplied. But when you gave Covishield permission in January, it also did not have immunogenicity data, yet you gave permission. Then came Pfizer. You returned Pfizer's application saying that they do not have local bridging trials. Okay, but you gave permission to Covaxin in January, even when they did not have phase 3 data, leave alone bridging trials. Right? Even now, we are speaking in May. Even in May, they do not have the phase 3 trials published of Covaxin. So we should have given more permissions for vaccines in India early enough. Number one. Number two, we did not make, like every other country did, at-risk investments in vaccine companies for both R&D and capacity expansion, like the US did with Moderna, Germany did with BioNTech and Pfizer, or UK did with Oxford AstraZeneca. We did not do that at all. In fact, even today, we have not given a penny to any private or public vaccine company in India in order to either do R&D or do capacity expansion as other countries have done. Number two. Number three is, when did we place advance purchase orders for vaccines? When countries began ordering for vaccines in June 2020, India placed its first order for vaccines only in January 2021. Right? Even Bangladesh had placed its order with Serum Institute of India in November 2020. Right? So given these series of failures in public policy with respect to planning for vaccines, it is not at all surprising that we now have a situation of an acute shortage of vaccines. We have phenomenally bungled in planning for vaccines in India. And that is the elephant in the room, as I said in the beginning. The second point is, most countries of the world use accountable groups of scientists who are put together to advise them. And it is these scientists, for example, Anthony Fauci of the United States, or others of the task force, of which the Indian scientist Venki is also part of. That's the group which decides the government's policy matters in the UK. And it is they many times who approach the press and speak to them, and via them speak to the people. In India, we have mainly made it into a bureaucratic exercise where an IAS officer comes and starts praising the government incessantly with no basis in data, no basis in science. It's politics rather than reason that has guided policy on not just vaccines, but also generally COVID control in India. That has been a serious problem. So we have not we have not engaged the scientific community as much as we should. That's the reason why many scientists today are coming out in independent media and are giving opinions which are fundamentally opposed to what the government's line is. So there is a clear divide between science and the government's policy in many respects. I'm not saying in all respects, but in many respects, there is a clear dividing line, and that is very pronounced in the case of vaccines for sure.
Yeah. So, as a developmental economist, I mean, which you are, in the sense that you know that if you spend money on something good, it will eventually work in favor of the nation later on, right? And this is such a easy thing that the health of so many millions, the entire population of India, if it was. So why is the government dithering? I mean, in the sense that every other, is it because India does not have a public health policy of sorts? It doesn't pay for the health of its citizens like, say, an America or Europe does. And even today in America and Europe, much of the vaccines, I mean, even for COVID vaccines, is funded by insurance. In India, we don't have that. I'm just asking, what is the impunity with which the government said that we are taking our hands off this? Is it because they did not have money? They don't have experience of actually paying for the citizens' health? Or what is it that makes them come back and say that in a situation like this, when so many lakhs of people are dying, we are not paying for it?
Historically, there is a sense of impunity on the part of governments in India. And there is a sense of complete disregard for basic conditions of human life in India, which has gone unchecked. Okay, that's an unfortunate part of Indian democracy, or the development of Indian polity itself over the last 60 to 70 years. You will see that in many respects. For example, I'll give you a simple example, which I keep saying in my classrooms: child labor. Okay, which other country in this world of India's stature allows so many crores of child labor to persist in India and keep these children out of schools? We are aiming to be a 5 trillion economy. We are aiming to be a superpower in the next generation, and so on, with so much of child labor, with so much of illiteracy. So simple things of human, which are so central to the material conditions of human life, such as education, literacy, mortality, all these are not political slogans in India, are not political issues in India. Amartya Sen once wrote, "Why is basic education not a basic political issue in India?" He was surprised that in every other country, a few thousand children out of school in the streets would be a huge problem, but not in India. Hum to aise hi hain. It's that kind of attitude which prevails in India. This is in the case of the basic issues that we are talking about here today, COVID, vaccines, and so on. It's as much prevalent in these attitudes of the government as is in earlier other spheres. In India, if you see, there is no dearth of official reports, there is no dearth of documents which suggest that India should at least double its expenditure on health via the center and via the states. But there is absolutely no action on the part of the government. If you take education, we have been trying to invest 6% of our GDP in education from 1960s. But we still have not invested more than 3% of our GDP in education. So in this whole debate, this whole state versus market debate, which is often, people get lost in this state versus market debate, is completely, completely inappropriate in this context. Okay, if you look at the expenditure of a government as a share of GDP, it is about 35% in the United States, and it is about 36% in China. Okay, very comparable percentage of government expenditure to GDP. Look at a country like Germany, 44% is the share of government expenditure to GDP. Where does all this expenditure go? To fund education, to fund health, to fund basic research, etc., etc. Not in India. In India, the number is around 25 to 26% only. That is at least 20% of the GDP less than what Germany does, for example. This attitude, this sort of stance of public policy, whereby you think that the state, when I say state, I'm not saying as a central government or a state government. I'm combining the ruling class as in one set. The state in India does not consider it imperative politically, democratically, it does not consider it imperative to invest in the basic material conditions of people. And that is a huge failure of Indian democracy in over the last 60 to 70 years.
If I were to just ask you, I mean, relatedly, um, what do you think will be the cost? I mean, it's not a kind of question that anybody can put together, but you always, as economists, look at these kind of questions. What will be the cost of so many people dying to the economy because the vaccines were not given in time? How much would it shave off the GDP growth, or what would be the pace of growth that it would slow down, and what would be the loss to the economy? Will somebody ever do this calculation, say, going forward, or is it being attempted at all?
So look, estimating the cost in terms of GDP of deaths is not an easy thing to do. But what people have done, I'll put it in. I'll turn around your question and answer it in a different way. Look at it this way: in United States or United Kingdom, because they have had considerable success in vaccinating up to 45-50% of their populations, they are now opening up their economies. People, the requirement of masks is anymore not as strict as it used to be in the past. You can go, restaurants are open, shops are open, factories are open, economy is slowly limping back. Not in India, right? You can't, you still are in a lockdown because you have vaccinated such a small proportion of your population. So not providing vaccination quickly would mean delaying the normalcy in the economy. And that delay in normalcy in the economy can be calculated as a cost. Okay, so for example, myself and one of my colleagues, Tejal Kanitkar, calculated using some data from last year's lockdown, 2020's lockdown, that India would be shaving off something like 15% of its GDP in the case of a lockdown, which is of a duration of about 50 to 70 days. Okay, that's roughly about 2 months' time. We'll be shaving off 15% of your GDP. That would mean, that's a conservative estimate, by the way. If you allow things to be a little liberal, you can go up to 20% loss, right? Now, that kind of loss could have been a one-year loss, a one-time loss of 2020 if we had quickly vaccinated people this time. But then the second wave came. We are now under the fear of a third wave. Okay, and even now we have not vaccinated more than 20% of our population. It won't be by December that we will be vaccinating 35 to 40% of our population. That means these third wave, if it hits you early, and the second wave, and it does not fully ebb by say June or so. If it continues till July or August, we're going to have prolonged lockdowns till July and August. All this is a loss to the economy. Right? And these are losses which other countries have managed to avoid by quickly vaccinating their people. Right? So in that sense, answering your question, it's a huge economic loss. If last year's lockdown is to repeat this time and it extends to up to 50, 60 days, we are looking at another 15% shaving off of our GDP, which has other costs, which is because that in nowhere is representative of the extent of employment loss. If 15% GDP loss is there, employment loss is a multiple of it on the other side, right? So that means loss of income to people, loss of livelihoods to people, loss of demand in the economy, delayed recovery, right? The shutdowns, which will permanently damage, irreparably damage sectors of the economy. All this are the reasons why we should vaccinate as quickly as possible so that our economy and society can come back to normal as quickly as possible. But we in India appear to have been in a celebratory mood in February, where we thought that our Prime Minister declared that India has defeated coronavirus even without vaccines. That was his announcement in February. Look how silly that statement looks looking back from May.
Sure. Pradip, you want to take,
some questions? Yeah, there are a lot of questions that are being asked. Ashok, my colleague, has asked, in its rush to deflect criticism, is the government getting arm twisted into agreeing to indemnify vaccine makers? And a similar question has been asked by Bhaskar. What do you think about the indemnity clause that Pfizer is pushing for?
Look, let me keep Pfizer apart. Let me talk about other indemnifying questions of India, like SIIs or Bharat Biotechs, right? Now, across the world, this is not an issue. The reason is because governments across the world have invested in these companies significantly. Now, given that governments have invested significantly in these companies, government has enormous leverage over the decisions and policy pathways adopted by these companies. So, if government says it cannot indemnify, the companies have to fall in line, because that's been part of the agreement. That's been part of the exchange of money between the government and the company. Not in India. In India, you have simply not invested in any of these companies, public or private, right? Sometimes we call them suit boot ki sarkar, right? Okay, fine. Don't invest in public sector because it's against your neoliberal ideology. Fine. But did you invest in private at least? That also has not happened. You've not invested even in suit boots, in the sense that if you had invested money in capacity expansion of Serum Institute or Bharat Biotech or Dr. Reddy's, all these are private. Okay. Apart from public, there are also public companies. There are at least 8 major public sector manufacturing companies in vaccine sector in India where we have not done any investment. If the government had invested money into these companies and locked them into contracts which do not talk about indemnification, as it has been happening in the West, we would not be discussing this issue at all. Okay, in the West, the governments have locked them into contracts of the kind where they have to agree to what the government says. The Moderna is selling in the international market vaccines at $20 per dose, but you know how much it is selling it to the US government? $12 or $13 per dose. That's why that's the reason for that is because US government has invested $2 billion in Moderna Therapeutics. It cannot say no to it, because that's part of the deal between the government and the private sector. Not in India. Here, the Serum Institute of India or Bharat Biotech is able to be audacious enough to stand up and talk to the government and say that we will charge as much as we want indemnification and so on, because the government has given them no help at all. They have raised it on their own. All SII's money has come from Gavi and Gates Foundation, about $150 million. Nothing has come from the central government. The only thing that has gone from the central government is advance purchase orders accompanied by advance payments. That's all. No investment, no support has gone into that. So you should be able to restrain private companies from asking what they want to ask and get away with it. Countries across the world have regulated these companies, have locked them into contracts whereby they do not make demands of this sort. Not in India.
Advait is asking this question. Do you think what do you think about the 10 trillion package in the context of state intervention? Only 2 trillion rupees was cash and the rest was liquidity guarantees and other contingent liabilities.
I think the mention he mentioned here is about the last year's economic package announced by the finance minister, where the amount was 20 lakh crore rupees. That was the size of the package announced. And some of us had written at that time itself that the total fiscal component of this economic package did not exceed more than 1.5 or 2 lakh crore out of this 20 lakh crore. If you look at across the world, look at Trump's economic package or Biden's economic package today, or Boris Johnson's economic package in UK and so on, up to about 40 to 50% of their economic packages consisted of fiscal spendings, direct spending by the government. In India, only about 5 to 10% of the total package size comprised of fiscal, direct spending by the state. Rest was all bank guarantees, loans from banks to infuse liquidity into companies and so on and so forth. And that 90% part is completely unfulfilled in India. If you ask today how much extra money the banks have given, you will find that they have not even scratched the surface of the 18 lakh crore that is remaining in the package. Right? So this is one side. The second is that now that we are talking about vaccines, in the last budget, there was some amount of rupees 35,000 crore set aside by the central government for vaccine development and vaccine purchase. Right? That money would have been, look, I made some quick calculations. If you pay a company like Serum Institute 400 rupees per dose, okay, and buy it from not 150, but 450 rupees per dose and buy it from them. To buy all the vaccines that we need to cover 100% of the 18 plus population, India would require only about 53,000 crore. And that comes to about 0.24% of our GDP, right? And that's only a little higher than the 35,000 crore that we have already set aside. What is happening to that money? What is happening to that 35,000 crore, which was announced in the budget for vaccines? Number one. Number two, what is happening to your PM Cares fund? How much is there? How much is being spent for vaccines? We don't know. Then there is a COVID Suraksha fund of about 900 crore, if I understand it correctly. And that is the money to be given to companies for R&D in vaccine development. How much of that is given to the companies? We don't know. Right? So there is enormous amount of lack of clarity on what the government has done. There is enormous amount of muddle in terms of the thinking on the part of the government in terms of how to go about addressing this pandemic. And the last part I would like to say is, because we started with the economic package, we want another large economic package today, because this lockdown has led to enormous loss of livelihoods, loss of employment. We are staring at another period of negative growth rates of GDP and so on. And here we need support in employment, support in food security, support in other basic conditions of people's lives. And where is it? There is absolutely no talk about a second economic package. That economic package is over in 2020-21. We need another in 21-22. There is absolutely no talk about it. Where is the Garib Kalyan Yojana? Where is the Anna Yojana? All these yojanas that were thrown at us in May of 2020. Where are all those packages today? Where are all those schemes today? You even privatized explorations to space in May 2020, saying that they are actually pathways to inject demand into the economy. Has anything happened to that at least? When there you don't have any progress, right? So I'm really at a loss to see what is the economic policy of the government in terms of addressing the socio-economic impacts of the pandemic. We have been talking about vaccines. That's one failure story. Now, another failure story is regarding what is happening to the economy. But that demands a larger discussion, of course.
Ashok has asked a very interesting question. Sorry, Suri.
Sure, go ahead.
In the initial months of the vaccine rollout, there was a clamor for opening up availability in the retail market. The government did that to an extent now. How can then it be blamed for doing what many asked it to do?
Look, there's some misconception here, which is often shared by a lot of people, which is it was the states which demanded that the vaccine policy should be liberalized. That is far from the truth. In fact, the spirit of the demand from the states during February, March, etc., was that central government should take care of procurement and state governments should be given complete freedom in distribution. Okay, so there should be autonomy, flexibility given to the state governments to decide upon which section of the population to give first, whether to use an app or not, whether to do rural area first or urban area first, whether to do door-to-door or centralized in a camp. All these are decisions which you typically leave to the wisdom of the state governments. That was the argument of February and March. But the central government, what it did was, it very clearly saw that vaccines are in shortage. There'll be a lot of blame coming on top of it. So it used these demands by the states to simply say, to evade responsibility and simply say, we will do only 50% from now. 50% is up to you. You buy and give it to your people. We don't have any role in it. There was an economics to that policy, which is deregulation of vaccine prices, allowing vaccine companies to charge higher prices, super profits. That's the economics of it. But there is a politics to it, which is that the central government wanted to, from then on, blame the state governments and evade all responsibility for arising out of the public anger that might result from vaccine shortages. That is the political side of that story. Now, here is where the question which was asked now is extremely important. There was no demand from any state that vaccine procurement should be decentralized. The demand was that vaccine distribution should be decentralized. And that continues to be the right argument. Vaccine procurement should remain with the central government, which will pass it on to the states, which will pass it on to its citizens.
Surya,
I'm a little curious, in the sense that We know of capitalist government, we know of communist governments, we know of socialist governments. So 3 years down the line, when you actually look back and see what the government has done and compare it to even very capitalist countries like, say, in America or China, where would it leave India? What sort of story do you think, what sort of synopsis will be written for what has happened in India during COVID and the kind of vaccination policy the government has taken?
You're asking very sad questions. It's simply pulls down the mood of this engagement towards the end of it. But but the point is, 2 to 3 years from now, I will. My own calculations show that we are not going to vaccinate 100% of our population before 2024. Okay, and by that time you will have the children also coming into the net. So that category, that's about 30% of the population will also get added to the target of today. And so the story is going to continue for quite a bit of time. I don't think children plus adults in India would be vaccinated before 2025. Okay, right. At least. But what is the story in United Kingdom, United States, etc.? They've already completed 50% of their population. The rest 50% they will finish very quickly. Now they also have problems of anti-vaxxers and so on, but they will certainly reach 80 to 90% in about 6 months or 8 months from now, and that's going to be a phenomenal achievement. Now, as I said earlier, we started this discussion from the role of the state and the market and so on. The key question, across the world today, the role of the state is being seen very differently as during the Cold War. Okay, in the Cold War time, there was the state market debate, freedom versus autocracy debate, and so on, very much there in the public domain. That era is over. Even with China and Russia on one side, you do not see the debate as polarized or dichotomized as it used to be in the past. There is increasing realization across the world that the role of the state is extremely important, not just in terms of regulation, not just in terms of provision of just public goods, but also in terms of investing just as a partner with private companies, investing in areas like infrastructure, education, research, etc. In fact, a huge story in the vaccine and drug business is public investment has played a very important role in country after country to reduce the risks of private players in making initial forays into drug development, vaccine development, etc. That's the story of the capitalist West. Okay, but in country, I'll give you one more example. Tesla. Okay, if you read economists like Mariana Mazzucato and all, you'll see that they're pointing out that Tesla, all the development of electric cars that Tesla has made over the last 10 years or so was founded by a major grant by Obama government after the financial crisis of about 450 million US dollars. Right? That's how Elon Musk's empire was built in the electric car business of Tesla, though he today sort of makes fun of governments, their intervention and so on. He was very happy to receive that kind of money from Obama. So across the world, there is talk of the new state. Whether you agree with it or not is a different matter. The state is not anymore seen as simple provider of public goods, simple regulator of the economy and so on. It's also seen as an entrepreneurial state. Okay, that is, it walks with the private sector, invests a lot of money, and also partakes in the benefits of those innovations and discoveries that are made. That's a completely new role for the state that we see across the world. And that's the way the capitalist West is walking, particularly after the 2008 financial crisis, right? It completely destroyed the credibility of the free market argument. So this is something that is far from the discourse in a country like India. I wish. Sorry.
Go on. Sorry.
No, I wish that this discourse had entered India earlier enough so that we would have made sufficient investments. Forget infrastructure and all, basic things like education, health, nutrition, etc. We need significant investments to be made here, and then into basic infrastructure, right? Then into questions related to basic research. How much does India fund basic research in a country like India, where there's enormous scope for expansion in knowledge industries and so on? Very little compared to the capitalist West. Right? So there are things that India has to learn, not being, this whole slogan of minimum government, maximum governance, and so on, has completely no meaning in today's world. It's just some argument in some argument from a bygone era, which is being repeated to Indian people. The state, the idea of planning, etc., are returning to the public domain across the world. Not exactly in the same way as they existed, say, 30 years back, but in a very imbibing the new and modern facets of the world economy globally.
I think we are
Enormous amount of innovations happening in how intervening in the economy. I hope India learns from these experiences of the West.
where do we go from here, Ram? I mean, we spoke about the possible third wave and everything. I mean, we have seen whatever has happened. We know the uh, the the problems that have happened, right? We know where we have faltered and everything. In can we take everything in stride, and where do we go from here to ensure that we don't make the same mistakes should a third wave come?
I think we have not learned from the first wave when we tackle the second wave. Okay, that's one big failure. At least we have to learn from the second wave. And we have to see, I mean, one big thing that I've always argued from the last year itself, I've argued this, that people talk about using the crisis as an opportunity sometimes, right? What is it in the Indian context? Many people think that, crisis should be used as an opportunity in terms of opening up markets and so on. That's the way some people use that phrase for. I see it in a very different sense. I think India should use this opportunity to invest heavily in public health. If India had invested about 1% of its GDP in public health between 2020 and 2021, we would have made enormous progress in equipping ourselves to deal with the pandemic during the second wave. Enough doctors, enough nurses, enough hospitals, public health centers, ventilators, oxygen. The most signal failure of the last year, inability to produce enough and transport oxygen based on our demand and supply. All these require enough public investment. Private investment also would be required, but the government guides the process. Where the demand is, where the investment should flow to, what are the incentives to be given to private companies? If you provide them incentives, what is the quid pro quo? What are you getting back from them for public welfare? This is how states across the world are thinking. Okay, in the Tesla example that I gave, the argument of Obama was, okay, I'm giving you this loan. If you don't repay it, I'm going to take 3 million of your shares. Right? So there's a quid pro quo involved. So you have to innovate. The state has to innovate in its policy making, and I see complete absence of any innovation in the way the government is approaching the crisis. And I'm very worried. I'm very worried about where the economy is going. We still don't see any urgency on the part of the central government to intervene in the economy, spend in the economy, increase demand in the economy, put money into the pockets of people so that they can come out of this crisis without much damage. That's extremely important. But I'm very worried that if the third wave is as bad as it is now, not just the third wave, we have not yet quite seen how the pandemic would look like in rural areas if it spreads with much more ferocity there. All those are really worrying things for the future. And I truly hope that the government makes course corrections, accepts its mistakes, does not be stingy on spending money. It has to spend where it is required. It has to be innovative in terms of thinking. It has to accept its mistake and make corrections. That's extremely, that openness is extremely important in policy making in India, which I unfortunately see really lacking in the Indian context today.
We are running out of time. So, Suri, you have any last questions?
No, I have several last questions, so I'm not going to sort of. So, yeah. So therefore, this will be, going down further. Maybe, as I said, in 2-3 years, this will be one of the worst examples of public health intervention by a government, right?
Unfortunately, it looks like, because given the way countries across the world have dealt with the pandemic, India will be marked alongside Brazil. India would be marked alongside countries of that sort in the way it dealt with the pandemic, right? And that's very unfortunate. The world is standing with science, and we are spreading coronil as the solution, right? The world is standing with scientists, right? Here, there is a charlatan who is actually coming on TV and saying all doctors are robbers, right? So we have completely lost track, and our government of our polity, particularly the mainstream political discourse, is unable to deal with this problem with any amount of reason as the guiding light, may I say. That is a very important problem that I see. It would have been, India's response would have been much better if it had stood by science, if it had involved scientists and public health specialists into its committees and so on, which will decide it for the government. Instead, what we see is, look at a simple point. Instead of having public health specialists, we invite the CEO of Fortis, CEO of Medanta, and CEO of Apollo to sit in government committees. What do they know about public health, right? It's also what I'm also referring to is complete lack of direction on the part of the government, even when it decides to take advice. It doesn't take advice, but even when it takes advice, it takes advice from people like this. It's like in the 2000s, you had this committee on higher education, and it was chaired by Mr. Ambani and Mr. Tata. Right? That's not how things are done. Right? So I really hope that India, 2-3 years from now, as your question mentioned, does not look like a laughing stock in front of the world. There is time. We have time to course correct. We have time to do things better on the vaccine front, for example. We can better prepare ourselves for a third wave. We can infuse money into the economy to save it from collapsing for a second consecutive year. All this can be done. But the question is there political will to do it? That's the $1 million question in front of the country today.
Sure, Pradip.
Okay. Thank you so much, Ram, for taking time out and joining us for this discussion. It was really, really lovely to have you. I'm sure we have understood a lot of things. I am taking away a lot of things from this conversation. Thank you, everybody, for joining us for this webinar. And yeah, take care. Take care. See you next time.
Thank you for everyone. Thank you for watching, and take care, everyone.
Thank you, Ramakumar. And we're looking forward to reading more of what you write on this.
Pleasure. Thank you.
Thank you.